Hello everyone, happy Friday. Hope everyone had a beautiful, wonderful week. As you all know me, I am Alana, CEO and founder of Bling Faces Skincare, and I am going to do a live. I'm going to do a live demonstration of microdermabrasion along with a chemical peel. So, chemical peel season is still in. For those of you who do not know, chemical peels can only be done in between the months of September to June. Anything after June, I don't recommend anyone getting a chemical peel because it is not good for the skin. The sun is out and it will actually burn and harm the skin. So I'm going to wait for more people to jump on the live. Hello, welcome everybody. I have my Bling Beauty here, Miss Kina. Thank her. So what we're going to do for Miss Kina today, as I have said a few moments ago, she's going to be getting a microdermabrasion along with a chemical peel. And some of you may think, oh my gosh, that's a lot. Why would someone have a microdermabrasion followed by a chemical peel? Well, rest assured, it is not a lot. As a matter of fact, what people don't realize is that when you go for facial treatments, your clients actually want to see an improvement. Your clients are expecting that when they walk through that door, they have a significant difference in their skin. And microdermabrasion and a chemical peel goes hand in hand, and it does wonders for the skin. So it actually is better for the chemical peel and better for the microdermabrasion. It definitely improves the texture of the skin. It fades your dark spots. It boosts collagen in the skin. So I'm going to wait for more people to jump on. By the way, I hope everyone had a lovely week and cheers to a beautiful weekend. So I'm just going to wait for more people to load. So bear with me. So I'm going to just do a little housekeeping. I'm going to talk a little bit about chemical peels. So the kind of chemical peel that my Bling Beauty is going to be getting today will be a light chemical peel. She's going to expect to see some shedding. She should expect to see shedding within 2 days of her having this peel. She's going to be getting a glycolic acid peel. And the thing that I love about glycolic acid peels is that it penetrates deeper into the pores than, let's say, your salicylic acid peels, your lactic acid peels, and your mandelic acid peels. Also, it's going to just peel off the first layer of the skin. First layer of the skin is known as the epidermis. So we're going to get started. Thank you all for tuning in. Whoever is here, thank you. So first things first. I forgot my my timer. Okay. So Kina here already had her facial. We've already gone through the cleansing process. We've already gone through the massage process. So right now we are going to move on to the microdermabrasion. So I have here, excuse me guys, my diamond tip. So she's going to be getting a diamond microdermabrasion. So here it is. So before you start to use the microdermabrasion, you want to test the strength. You don't want to do it too much. And since she's going to be getting a chemical peel followed by this, I don't want to apply so much suction. I want to be very gentle on her skin. So what I like to do is I like to use my glove and kind of test out my suction and my pressure. So this is a diamond tip. It's diamond crystals at the tip. So we're going to start, we always start with the cheek area. You always want to kind of hold the skin like this, those of you can see. So I'm going to do long strokes. How's that? Okay. See? My suction, too much suction. Got to turn it down. Okay. It's supposed to glide on the skin. Okay. There we go. So you want to do long, even strokes. You don't want to apply too much pressure because she's going to be getting a chemical peel followed by this. And we don't want to irritate her skin. So we're getting a chemical peel because we want to lighten up these hyperpigmentation areas. She has dark spots. So the key to that is definitely chemical peels. Yes, you can use creams. There are lots of creams. There are lots of topicals on the market. But chemical peels are more effective at removing dark spots, improving acne, softening the texture, smoothing the texture of the skin. So as you can see, I am doing long, even strokes. Don't want to irritate. You could actually see her skin lifting up. I don't know if you guys could see what I see, but it's actually lifting up. Oh my gosh. Wow. Long, even strokes. Don't want to overdo it. Start with the forehead. Long, even strokes. So with the glycolic acid peel, everyone, you should expect to see some flaking, some shedding of the skin within 2 days of receiving a glycolic acid peel. And the shedding and the flaking of the skin will last approximately 3 to 5 days. However, if you don't mind having any shedding or flaking of the skin, then it's suitable for you to have it. But they also have a lot of mild peels out there on the market where you will not see any shedding. But how effective they may be, I don't know, because the purpose of the chemical peel is you want to remove that top layer of the skin. That's what you want to do. Okay, let's turn here. Remember, long, even strokes. Wow. And it's recommended that to have a good result, you should have more than one treatment of a chemical peel. I like to say 5 to 6 treatments of a chemical peel is ideal to get the ideal look that you're going for. Also, you should also get a chemical peel at least 3 to 4 weeks after receiving one. You don't want to wait. You don't want to do it before the 3 weeks, because you definitely don't want to irritate the skin, and you don't want to damage the healthy skin that you do have on your face by overdoing it, because it is a chemical, it's an acid. So glycolic acid is a alpha hydroxy acid, one of the best acids out there, because glycolic acid is easily penetrated through the skin to the pores. So I want to get this chin. I want to do nice, long, even strokes. Oh my God, I know you all can't see what I'm seeing, but her skin is actually being removed. Wow. That means that chemical peel is going to be bomb. How you feeling, Bling Beauty?
I'm feeling
good. Okay. Get that neck. You always want to get the neck too. Always want to get that neck. And also, I can't speak for other practitioners, but when my clients come in for chemical peels, they get the whole shebang. I don't slap a chemical peel on my client's skin, wipe it off, and send them on their way. I actually do a complete facial, you know. And if we have time, I do the microdermabrasion. But I have my client here who's familiar with microdermabrasion, and she wanted it. And I suggested that she have it too along with her peel. It will complement her peel very well. So for those of you just logging on, once again, I want to mention I am Alana, founder and CEO of Bling Faces Skincare. And thank you and welcome to my live. I am doing a live demonstration on my Bling Beauty here. She's getting a microdermabrasion along with a chemical peel. Okay, so I don't want to do too much. Let me just go over this area here. How's your face feel?
I feel good.
Okay. Okay. I can actually see her hyperpigment areas lighten up as I go over my wand. Wow. Okay. So we're going to cut it with the microdermabrasion because I don't want to do too much. Like I said, I don't want to irritate her skin. And okay, so we are now ready for the peel process. So I like to do my chemical peels in 2 steps. Why? Because I want to introduce the peel to the client's skin. So the first thing I like to do, my first step, I put the peel on. I leave that peel on for no more than 1 to 2 minutes. And then I wipe it off. And then I reapply and I leave it again for an additional 5 to 10 minutes. And that's according to how they're tolerating this peel. So I have my peel here. Anyone can see it's glycolic acid, and it's best to use 30%. Anything over 30%, you have to leave it to a professional. Don't try to do it yourself. Don't go order anything off of Amazon. Oh, Mom, I saw this tutorial. No, because you don't know what you're doing, because it's an acid, and you can actually damage your skin. So, for starters, I like to start with the chin. And then I'm going to ask her how she feels. So here we go. How's that?
That's good.
Let me know.
Cold.
Cold?
Mm-hmm.
Okay. And also, too, I don't have my neutralizer, but it's good to always have your neutralizer, which is sodium bicarbonate, because it neutralizes the acid. So if it was to start burning her, I'll just apply my neutralizer. Get that burning on the way. How's that?
Okay.
Is it burning?
A little tingly.
A little tingly?
Mm-hmm.
Okay, that's what I want to know. That's what you want to feel. A little tingly is always good. So the faster I put this on, the faster I'm going to remove it. Because remember, this is my step 1. I just kind of want to like introduce it to her skin. And then when I go for round 2, we leave it on a little longer. How's that?
It's okay.
Is it burning?
No.
Okay. Good. She tolerates it very well. So that means when we go to the second step, I can actually leave it on for the full 10 minutes. Okay. Yeah. So once again, after June, some say May, but I say after June, you do not want to get a chemical peel. It is not good for the skin because it's summer, the sun is out, the sun will burn your skin. So that's why we recommend from September to June. It's a good window to get your chemical peels done. So ladies and gentlemen, I suggest start getting your chemical peels now. We are in April. Today is April the 12th. So you got a little time. You got a little time. And also, if you require more than 1 session, I suggest you get started now. How's that feeling?
Okay.
Okay. You sure?
Mm-hmm.
Okay. Want to hit up that neck. And after getting a chemical peel, your only concern is about keeping the skin hydrated and protecting it from the sun. So you're going to have to fall in love with your moisturizer. Your moisturizer and your sunscreen is going to be your very best friend when you get a chemical peel. Okay, I see a little redness here. How's that? How are you feeling? It burning?
Not burning, more itchy.
More itchy? Okay, good. Okay. Okay, so this is step 1, guys. For those of you just joining, I just mentioned I like to do my chemical peels in 2 steps. My first step, I like to apply it and leave it on the skin for no more than 1 to 2 minutes because I want that skin to get used to it because she has never had a chemical peel before. So you definitely don't want to shock her skin and you don't want to burn it and irritate it at the same time. So I'm going to go ahead and I'm going to wipe it off. So anyone have any questions? I'm taking questions. So she should expect to start seeing some flaking within the next 48 hours, which is 2 days. And also, whatever like little small pimples that she has, chemical peel is going to take care of that. It's going to actually dry it up and draw everything to the surface. So when she washes her face, everything is going to come up at the same time and clear up her small pimples that she has. She just has like some small white heads, some small black heads, nothing major. Do you feel any itchy and tingly anywhere else?
No.
Okay, so that was step 1. So I'm going to go again. I want to make sure I thoroughly wipe that off before I put it again. So there are a lot of other peels that actually can remove at least 3 to 4 layers of your skin. And those are known as your Jessner peels or your TCA peels. A peel like that, you need to be in your house at least for 7 days. Because the point of getting a peel like that is actually to have your face look like a brand new newborn baby. That's why everybody, we work hard, skincare experts, products, we work at trying to get newborn baby skin because they have the best skin. It's beautiful, it's soft, it's clean, it's clear, it's supple, has great elasticity. Yeah. How are you feeling?
Okay.
Any itching anywhere?
No.
Okay, so we're going to go back for my second step. Okay, round 2. Hi everyone, thank you for joining. Those of you who are just tuning in, if you don't know who I am, I'm Alana, and CEO and founder of Bling Faces Skincare, and welcome to my live. I am actually doing a microdermabrasion and a chemical peel live. Okay, glycolic chemical peel. So I am moving on to step 2. How's that feel?
That's good.
Okay, I'm looking at my time. 7:11. So this peel, we're gonna leave this on for about 10 minutes. Pretty much, as long as you can tolerate it.
Okay.
Okay, how are you feeling?
Okay.
So also what I like to do with my peels is that I also follow my peels up with a nice soothing mask because I want to calm down the pores in her skin. So I like to follow with a nice soothing mask. Please note, all of my peels come with a complete facial and a nourishing mask to conclude it. How are you feeling?
Okay.
Is it itching?
Mm-hmm. It's not bad.
Not bad?
Mm-mm.
Do you feel like you want to rip your face off?
No.
Okay. Yeah, you're good. So the longer you leave a chemical peel on, the longer that your client can tolerate it, it's better for the client. Because yes, of course, they're going to produce more shedding, more flaking, but it's going to remove all that dead skin and reveal healthy, beauty, glowing skin. Beautiful, glowing skin. So does anyone have any questions? Does anyone out there want to have a chemical peel done? Do you know anyone? Do you have a friend? Tag a friend. Let a friend know. Okay. So we're going to let that sit. Hello, and welcome. Thank you so much for joining in and tuning in. I am actually doing a live demonstration of microdermabrasion along with a chemical peel, a glycolic acid peel at that. So prior to the peel, client has received a full facial, area was cleansed, a nice facial massage was provided, and I love to do that because I like to awaken the skin cells. I like to have prep my skin, get it ready for the acids. I like for my pores to be opened so it can receive the product, so the product can penetrate and do what it's supposed to do. And I love to say the term do its job. So, how are you feeling?
Okay.
Is it itching? Scale from 1 to 10. What you feeling?
I go 3.
A 3? Okay. 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 Let me know when you start to get to a 4.
Okay.
So what I did here, guys.
It's really only on the forehead.
Okay. Okay, I see something. Let me start right to the forehead. So, as you all know, I am a registered nurse. So what I did was I used a pain scale rating to test her how she feels about her face. So in a nursing world, a medical world, I should say, we always ask patients, how is your pain? So on a scale from 0 to 10, with 10 being the worst and 1 being no pain, that's how we rate the pain. So in her case, I asked her how her face was feeling. She can say, oh, it doesn't itch that much, but that doesn't give me an indication of how she really feels. So that's why I had to ask her on a scale from 0 to 10, how are you feeling? So right now she is at a level 3. So 3, that means she is experiencing some type of discomfort, some irritation. But if she moves on to a 4 or 5, we know that we have to start removing the peel. So I notice here that her forehead is turning red. So I am starting the process of removing it from the forehead. And her forehead is the area that had like the most hyperpigmentation, or I should say dark spots there. How are you feeling now?
Okay.
So I want to give it a full 10 minutes. We're almost there. We have about 4 minutes left. So we have removed it from the forehead. So yes, expect anytime you get a chemical peel, expect that you may have some redness there, and it will go away. You may go to some skin specialists. They may put cooling gel on after. They may apply ice after someone receives a chemical peel. But in her case, I'm going to put a soothing mask on her. How's your forehead?
Good.
Okay. So you got like some redness here.
That's enough for that.
And also too, sometimes when you all get chemical peels, the skin may form a scab on it. That's okay. It's normal. Do not pick it. Let it shed normally. How are we feeling?
Good.
Where are we at now? 3? Still at 3? Have we moved to 4?
No.
No, still at 3.
Yeah. What about makeup? Like foundation, concealer?
You can wear your makeup tomorrow. Okay. And also, those of you who are makeup wearers, you can still apply your makeup on after you get a chemical peel. Not the same day, but the next day. So if you must wear your foundation, you definitely can apply it. But just make sure that you stay hydrated. That doesn't just mean drink your water. Of course, that means your moisturizer. Moisturize, moisturize, moisturize. And you're going to apply your sunscreen before you apply your makeup. How are you feeling?
Okay.
Okay, so you're starting to get some redness over here around your mouth. So I'm going to proceed with wiping that area. Okay. So we are now at the 10-minute mark, and I am proceeding to remove her chemical peel. Does anyone have any questions for me? I'm taking questions. Sorry about that. Okay. Do you feel any itching anywhere?
No.
Okay. So I see that I had someone join. Thank you for tuning into my Microdermabrasion chemical peel live. So I just concluded the chemical peel for my client. I definitely want to ensure that all the chemical is removed off of her face. So which is why you all still see me patting her face, because I want to ensure that I remove everything. So I definitely could see that she had some areas of redness. That's to be expected after a chemical peel. Don't expect to get a peel and you don't see any redness. All right, so I like to, as I mentioned before, I like to follow up my peels with a mask. So I have my nice soothing mask here. I have my other brush. I'm going to use this here. So this mask here is going to soothe her pores, relax her skin, because we did microdermabrasion and a chemical peel. So we kind of like stress her skin out a bit. So I actually want to relax it. How are we feeling? How's your face?
Okay.
Okay. How does that mask feel? Okay, so I also like to apply my mask on the lips, because remember, your lips have skin and the skin on your lips is very delicate. Okay. Okay, So my Bling Beauty has her soothing mask on. So I just want to do a little small recap before I exit. So once again, my Bling Beauty got a microdermabrasion followed by a chemical peel. Now, I mentioned before, and I constantly keep on mentioning, that we are in chemical peel season. So if you are thinking about having a chemical peel done, I suggest that you do it now, because chemical peel season is from the months of September to June. And the reason is because after June, summertime is here, the sun is out, the sun is hot, and that sun will burn your skin after a chemical peel. Sunscreen will help, but it will not be effective. So it is a good time to have your peels done in between the months of September and June. Also, client received a glycolic acid peel. Glycolic acid peel is an alpha hydroxy acid. Also, glycolic, unlike other acids, unlike other alpha and beta hydroxy acid, it is actually the only acid that has very small molecules and can penetrate the skin and down into the pores. So that's why most places, the number one pill that they use is really glycolic acid. So followed by that, chemical peels are good for lightening dark spots, clearing up your acne, tightening your skin, smoothing your tone, your texture, also providing you with a nice glow and building collagen in your skin. So those are the many benefits of having a chemical peel. At-home regimen, once you have a peel, biggest thing is hydration, 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 and sunscreen. You will need a sunscreen of a SPF of 30 or more. Once again, home care treatment for a chemical peel will be nothing but moisturizer and a sunscreen. Those of you who wear makeup, you can apply your makeup after you receive your chemical peel the next day. I suggest that you apply your moisturizer, followed by your sunscreen, followed by your foundation and your setting powder of your choice. So not only that, with chemical peels, you should expect to see some shedding within the next 2 days, 48 hours. And that flaking and shedding of the skin should last no more than 3 to 5 days. So in her case, she's going to expect in 2 days to see some shedding. Also, she's going to expect tonight and tomorrow morning to have a little redness. Any chemical peel that you have, you should expect to see some redness, especially if it's not a mild chemical peel, because you do have a lot of mild chemical peels out there on the market. But in her case, she got a little step up. She has a moderate skin peel, so she had a glycolic acid skin peel. So it is also recommended that you get more than one chemical peel to get what you're actually looking for. So specialists recommend anywhere from 5 to 6 treatments, and I suggest that we once a month. So we're in April, so guess what? You guys got to get started. So you only have room to at least get three chemical peels out of the way. So those of you who suffer with acne, chemical peels are a good gateway to help clear up your acne. So visit your nearby skincare specialist, book a facial with your skin expert, and she or he will definitely tell you the right course and right treatment for you. So this is going to conclude my live. I thank you all for tuning in and joining in. I hope that you all have had a wonderful week and have a beautiful weekend. It's supposed to be like 70 degrees tomorrow. By the way, I'm here in New York, reporting you from Queens in my studio. So I just once again want to thank everyone for tuning in. Have a lovely, wonderful evening, and I'll catch you later. You guys will probably see me next week on my live. So have a good night, and mwah.